thank you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. For this week's wellness segment, we're kicking off the month of February for American Heart Month. And today we're joined by Debbie Bryan. She's the Director of Cardiovascular Services at Piedmont Macon. Good morning, Debbie, and thank you so much for joining us.
Good morning.
Good morning. So, the month of February is American Heart Month. You know, it's a time where people focus on cardiovascular health. And so, according to the CDC, 1 out of 5 adults under the age of 65 actually passed away in 2019 due to heart disease. Can you tell us what is heart disease?
Well, heart disease actually is a lot of different heart conditions. The number one is coronary artery disease, which is actually the decrease of blood flow to the heart because of the vessels. And when you talk about heart disease, most of the time, that is what you're talking about because that is the number one cause of a heart attack.
Oh, wow. So, in addition, I mean, you just answered my next question. I was going to ask you, what are some of the leading risks that leads up to the heart disease? So you said heart attacks. Are there any more risks associated with heart disease?
Absolutely. So some of the risks are, it could be hereditary, but some of the things that we actually can control are diabetes, smoking, obesity. Those are the things that you see most often that are controllable to prevent you from having heart disease.
So obviously, if people don't smoke or anything like that, that can prevent the heart disease. What are some more things? I mean, is eating healthy a factor? Exercise? I mean, are there any more things that they can do to prevent this illness?
Yep, eating healthy, exercising, controlling your blood pressure, hypertension is a big cause. So yeah, just living a heart healthy life.
Okay. So with you being a director of the cardiovascular services at Piedmont Macon, I know Piedmont Macon offers, an array of services that, their patients can take advantage of. What are some of those services?
Some of the services that we would offer, we do offer a lot of non-interventional. So we do stress tests, we do echoes, we do EKGs. We can put an event or Holter monitor on you to monitor your heart for so many days. Some of the interventional things that we do are we do angioplasties, which is ballooning of the vessel. We do PCIs, which is where we go in and put stents in if you have a blockage. A basic left heart cath, which is the diagnostic to see if you have any blockages. We do a right heart cath a lot of times to check the pressure in your heart. We also offer some EP services, which would be we put in devices, pacemakers, defibrillators. We do ablations. We do a lot of, we also do what is called structural heart. So a couple of years ago, we started doing Watchman, which is a little device that they put into the heart for people that are in AFib. And it actually allows those people to come off of blood thinners. So like if you have a bleeding risk and you can't be on blood thinners, you can have a Watchman device put in, and that would allow it where you could actually come off of blood thinners and not be at risk for having a stroke.
Oh, wow. Okay. So I know that I mentioned, the data that I collected from the CDC about, the deceased individuals back in 2019. Do you see this common in younger adults or older adults? The heart disease.
We see a lot of, we do see a lot of younger people. Most of the time with them, they have a family history of heart disease. But we also see a lot of older people that do have the risk factors that we were talking about: diabetes, smoking, not eating healthy, obesity. Normally in younger people, though, like I said, it's normally hereditary, and we see a history of heart disease in their family.
Got it. All right. Well, thank you so much, Debbie, for coming on, just discussing, hopefully this helped people out there. But before we go, is there anything else you would like to add, as we, move forward in the month of February, people just to keep in mind, when they're doing certain things, hey, I need to watch out for this. I need to watch out for that. Is there anything else you would like to add before, we end the interview?
No, but what I will tell you, one last thing that a lot of people don't know is that women sometimes cannot have the typical symptoms and signs of a heart attack. Sometimes their signs and symptoms are different. Like when you think of a heart attack, you think of left arm pain or chest pressure. But a lot of times with women, they just may have nausea, vomiting, or more jaw pain, or just some heartburn. A lot of times people that have heart attacks talk about they just felt like they had heartburn. So I just feel like if it's something that is consistent and doesn't go away, or you're even worried about it, a simple EKG could give you the answer.
All right. Well, thank you so much, Debbie. And for more information on this, you can visit carlybtv.com. Thank you. Are you a homeowner, a parent, or own a business? What happens to those assets in the case of death?
Hi, I'm Cassandra Barron, your local life insurance agent. Life insurance protects your income in the case of death. Call me for your free quotes today.
Affordable coverage for the whole family, immediate coverage, no waiting period, multiple kids coverage for one price. Call Cassandra Barron today.